tell you, dear friend, this has been there for long. The only problem was that it was underdiagnosed, or you can say we had been coming up till date by the name called syndrome X, which means the same hypertension, the same diabetes, the same alcohol, the same other comorbidities or the vices which the persons were having were not being taken under one roof clear cut. One string was taken up, the other string was let loose. Fatty liver as it is was not known very much, and after the noise has been made about the NAFLD or NASH, things have started coming up much more, because which was previously the tip of the iceberg has now seen the whole iceberg erupting up. So, as a matter of fact, now you see the complete glacier on, and one has come to know reality about NAFLD, and the biggest thing which has come up as on date which everybody has been worried about is that undue obesity, and that has made us really gone for it. See, let me tell you one thing, it is absolutely correct, Dr. Gaurav. The amount of tests which have been really costing out, FIB-4 has cut it down to almost nothing. Every clinician goes for a test like an ALT and AST. The only thing which is added into it is the platelets. So, everybody does a CBC, and a CBC gives you the platelets in it. The formula, the calculator has been so widely open, you don't have to pay for it. You just download a FIB-4 calculator, it comes to your mobile, enter these values and the score is in front of you. The answer is that one should always see that it has to be less than 1.6, which means that you are in the normal range. So, no crunch can be said about presently with the FIB-4 advent, and it is one of the best handy point of care test which should be done by each and every clinician, whether it is a physician or a gastroenterologist or anybody. See, the point is, we all know that the initial drugs in the markets were metformin. The next drug was your pioglitazones. Now, these things had their own good effects as well as side effects. Any anti-diabetics which were considered to be good for decreasing down the elements of a fatty liver or a non-alcoholic fatty liver disease or a non-alcoholic steatohepatitis. These drugs were being used because they were seen time immemorial during our college days also. Next came was vitamin E. Vitamin E in higher doses, if given for a long period of time, has shown the mild increase in a good percentage of patients about prostatic cancers, especially in males. So, now of course, the need of the hour was to have good drugs. Unfortunately, there had been many drugs in pipelines, but most of them had phased out in the phase 3 trial. Fortunate was this drug, the saroglitazar, which in fact has been on trial since probably 2006-2007 and came into the market. After then, it's a PPAR, everybody knows it's a dual peroxidase inhibitor. So, the good effect was that it was basically initially started for being used to treat hypertriglyceridemia, which is a part of syndrome X or a part of NAFLD or a part of NASLD, which you call now, because metabolic syndrome is a part of your NAFLD now. As these drugs were being doing good, so it was basically seen that if your lipoprotein levels, if your triglyceride levels are coming down, then definitely there will be a good effect on the parameters of like AST and ALT being improving, and if they were improving, it means that the liver which was progressing towards a fibrotic area is having a reversal towards it. You need to see, a drug is there in your hand doesn't mean that the pill is there in your hand, you will gulp it. It has to be gulped absolutely ethically. If you are satisfying all the criteria if you see that your FIB-4 is going up, if you see that the fibroscan is showing some amount of the LSM values bit above 6 or 7, where the possibility that you are coming up to a grade 1 or grade 2 disease. If you are having the high parameters, if you are having a difficulty in finding out why a normal person has got a high hypertriglyceridemia levels, why the person has got a high LDL levels, why the person is having high LT and high EST levels, and a person who is obese at the same time, if a person has got a potentiality of a diabetes also, then of course this drug would definitely be better to be intervened as fast as possible. You start it up and presently is not known, but this drug being used for period of more than 52 weeks have been found safe till date. It's not a problem. See, let me tell you one thing. The difficulty in our country is that except for some big institutes who are really doing a good work regarding the data registry, India is one country which can give the best of the data to the world. Unfortunately, we believe on data from a small country like Sweden or Poland, which in fact is absolutely paradoxical. If our medical transcription system improves, which is very unlikely because of our population, in the Western world they see 10 to 15 patients a day. Here if you see 15 patients a day, you normally is considered to be a useless physician. It means you don't know how to see a patient because you don't have a rush in your clinic. So giving time to a patient is definitely nice and is needed. It's the, it's the time now that one should really, do as much time giving to the patient in order to extract a full proper history. If you take a full proper history, if you do a nice good investigation within a framework, not exaggerating the number of tests being done, no fancy tests to be done, and if you turn out to have a good drug with you and it fits within the framework of the investigation, definitely Saroglitazar is a good drug. I've been using it for last almost now around 12 years, and initially I was using it for high TG levels as it was recommended, but after its use and its FDA approval for the drug, the treatment of NAFLD, definitely probably this is the only drug after I named the previous three, the metformin, the vitamin A, the pioglitazones. This drug definitely is promising and we see good improvement in results, but time will tell. We need more time, maybe a few more years, for the real data to say that this drug will be one wonder drug for the treatment of NAFLD.